Human Health Education Research Foundation. I was approached probably around about a year ago by Ossama for no particular good reason as far as I was concerned, other than a sense I know you lot, and maybe the Leaders Club has now got some prowess behind it, that we have this eclectic group of people with real leadership experience in a whole range of spheres, hence the club. And since getting involved and being the privilege of being on the board, I am just amazed and astounded at the quality of people who are there. And in a sense, the TLC motto, bringing great minds together, is a great one, of which I say mine is always the least with this. But I think, as you'll find out with the presentation, it's all good news. And in fact, we will hear about wishes and how that actually means something with that acronym. And we hope that it's something that you will feel that you want to get behind. And I know we shall look forward to your thoughts and views. One of the great things with HHERF is through Ossama is the brilliance of the graphics and the website and so on. It makes me really envious to see the quality of that. So we do hope that you will think about it and see how you would like to involve. I emphasize, we're not asking you to dig into your pockets on anything like this. We want your support on the gist of what HHERF is about. And if you look at it, here we are tonight with Dr. Ashraf coming in from Egypt, Dr. Claudia coming in from near Cologne, and in fact, Dr. Jacob coming in from near Kuala Lumpur. So this is a first for anything like this with TLC. So without further ado, let me ask Ossama to start the ball rolling. Ossama, over to you, please.
Thank you very much, Steve, indeed. And I want to thank you very much, and Bob and the Leaders Club, for giving us this chance to be here. And as you just mentioned, HHERF came from people to people. This is the capital that we have. This is the asset that we have. You might be able to see some of our members today. You will have the chance to hear to Dr. Ashraf, who is our vice chairman, Dr. Claudia, one of our board members, Dr. Jacob as well, one of our board members. I know that Mark Adams is not speaking today, but he's our chairman as well. And we have a couple of the other team members listening and attending to this presentation. I'm going to start the presentation in a little bit a different manner. Usually everyone starts with a title for this presentation, but I'm going to keep the title for Dr. Claudia, but just to set the ground for this, how this starts and what we're trying to do. The situation of the COVID-19, we all have seen what happened and the devastating impact that did not leave anything that was not impacted. And this put all of us in a situation, particularly the people who are working in the health industry, to think once and twice what went wrong and how can we make a difference for the future and for our generations. And the first thing we started looking at, and if you allow me to share my screen, is the moment we looked at what happened across the planet. Can you see my screen?
Yes.
Yes. And we started to look at how the countries actually underestimated the danger of the COVID-19. They have always all been looking at the tip of the iceberg, but no one was looking at the size of the problem. Even though when we took some measures of locking down, we did not consider what this will impact our children and how they face psychological and educational neglect. On the other side, when we look about the gaps between the societies, the inequalities, these gaps has been tremendously impacted. And the gap even between the rich and poor people become more evident than ever. Despite that was the toughest economical year on the planet, but if we look at the top 10 richest people on the planet, their fortune, some of them has been multiplied by 6. Many people lost their lives. And the minorities, such as old people and ethnic groups, were disproportionately affected. And even our health systems, the reaction was very parochial. They couldn't cope with the rapid spread of the disease. And we ended up that all the efforts that have been there, all the years of philanthropic efforts to achieve healthy equality were lost, gone in vain. This is one of the pictures that you might be able to look at. But when you look at the numbers, and these numbers that you're seeing in front of you are just from the United Nations and the WHO archive, and we're talking about only 2020. 2021 until now, no tangible numbers that is reflecting the current situation. We're talking about 740 million women. Income globally fell by 60% in the first month of the pandemic. They are all working in the informal economy. We're talking about $3.7 trillion lost in the labor income. Considering that our planet has more than half of the population, 3.5 billion people, do not have access to essential health services. And even it's not healthcare services, it's health services. And when you look at the numbers of death today, we have around 4 million deaths, but it's not reflecting the real number, because there are 7 to 13 million non-COVID related deaths, but it's due to the lack of treatment because of lockdowns and others. Looking at the children, the impact on our children and how 463 million children worldwide were unable to access the remote learning. A lot, considering how many students are affected in countries. It's 1.6 billion students. And the jobs that were lost, 225 million jobs. All what you see in front of you is the suffering of the citizens of the world. Those are the people who paid the price. And still, the list goes on. Everyone was thinking like 2021, everything will be fine. But it looks like it's not. It looks like we're living with COVID for a longer time. This is what pushed us as a group of people together to think about the reasons of failure. Why did we fail? And these are some of the reasons that the team were able to identify. But you will find the title starts with lack of, which means that we're missing something. We're missing something. And this is the common thing between all the reasons behind failure. We started with the lack of transparency, accessibility of health data. And we've all seen this across the developed countries and the developing countries, with just different sources and different kinds of impartiality as well. And the second thing is the parochial approaches, where we missed and we lacked a global preparedness plan, where we work together as a one community. And this is one of the most important lessons that the COVID teach all of us, that there are no borders in disease and health. We're living in a very small world and we're all connected. And it's very easy that you infect a small country on the ocean and then you end up with the entire world having a pandemic like what happened last year. Within a matter of 20 days from the 1st of March until the 21st of March, 173 countries were infected. Going into the international collaboration, there was absolutely nothing. The lack of multi-sectoral involvement, and that's why we were there. And looking at the health systems capacity and the lack, the local and global production and supply chains. And one of the most important things that we lack: clear, timely, accurate, and consistent public education. We all understood that with the right collaboration, the right resource utilization, failures could have been avoided. I would turn the mic to Dr. Claudia, who can take us through the story behind the beginning of HHERF.
Thank you very much, Ossama, and a very good evening from Germany. Yeah, I would like to explain a bit the story behind HHERF. So as Ossama just summarized, we felt, or we saw, that there is a need to join forces and to have an organization which takes care on a worldwide basis. So Human Health Education Research Foundation was born in times of a crisis, obviously, as Ossama just said, and it was founded just last year in 2020 in London, when we witnessed, and I mean, you're all listening from the UK, you suffered a lot like we did in Germany, like unfortunately Dr. Jacob just reported to us from Malaysia, Indonesia, and the neighboring countries. So we witnessed our lives coming to a standstill, all of us. we were overwhelmed with what happened, and we developed a concept to learn from our past mistakes and to prepare us for the future challenges. And this most probably will be a never-ending story for all of us. But it was good that this foundation was born and that we now can do something. So we are non-governmental. We don't have to do anything with political systems. We are also very important not for profit. And we are fully committed to transparency with the highest standards of governance. And this is what we try to live and to stand for also in this board of directors, which is, as you just learned, greatly led by Ossama as our CEO. Our funds are to be spent on education and research to improve human health across the globe. And we will hear later on also an introduction to the first project we are going to have, which is our summit taking place later this year. Next slide, please. So, of course, as any organization who stands for quality, we have a vision and a mission. And the vision is to become the voice of human health, to empower generations, to create resilience, and to build a healthier future. And from my own experience, I am the CEO of an international accreditation body, and we certify and accredit hospitals worldwide. And when the situation came up that the pandemic started, everybody was completely overwhelmed. Nobody knew what to do. And we were contacted and we were asked for help. So that was a first little project, which now can be transferred also to Human Health Education Research Foundation, to becoming the voice of human health. And we are, all of us speaking today, are working in the health sector. So I think we know about what we're talking and the need to become a voice for and to build a healthier future. And of course, we have a mission, and the mission is what Steve just said in the introduction: building a world integrated, sustainable health ecosystem, which is the WISHES, the abbreviation for WISHES, by bringing multi-sectoral minds together. So, and if we go to the next slide, we get a first impression about the people at this moment which make it happen, but we are looking for much more support. But you see different faces, you see different colors, you see different age, you see different smiles. So this is behind HHERF. So to be different, but having the same mind and the same goal, to make the world a bit better in the end. So I'm very proud to be one of the people on this slide and being able to support, or hopefully being able to support the foundation as a board member. And you see just left and right to me, the following speakers of today. I don't know if this is by accident or if this is on purpose, but this is at this moment the faces behind HHERF. And if we want to bring it in numbers and figures, then you will see it on the next slide. At this moment, this is the number of today. We have 74 leaders from 35 countries already involved, representing 42 industries. And I think I can't see because your faces are on the right side, but I think it's 28 languages which are represented at this moment. So I think the founders, where I'm not one of them, I joined a bit later, did a great job so far. Ossama is amazing in bringing new people to the board as the international advisory board members, and the community, so to say, is growing day by day. So having said this, I would like to give the floor to the next speaker, which will be Dr. Jacob, and he has some practical experience to support the idea or the necessity to further work and to contribute to the solution which we want to offer with our wishes. Thank you.
Thank you so much, Claudia, for that introduction and for giving us an overview of HHERF And again, it's really a pleasure to meet with many of you from the Leaders Club. First time I'm hearing of this club, but hearing from Stephen, there's so much you guys do and so much we can do together. And the first question is, you might ask me is, why did you join HHERF? Well, just like Claudia and the others, Ossama and some of the other board members invited me. I'm a medical doctor based in Kuala Lumpur, Malaysia, part of a group called Ramsay Sime Darby Healthcare. We have some hospitals in Malaysia, some hospitals in Indonesia, and some in Hong Kong. And we have been reaching out to people and trying to create health awareness among the people we reach out to. In Indonesia, the population is excess of 180 million. And in times like this, what really prompted me to join is I see the suffering and the lack of awareness and the fright people have trying to face this pandemic. I'll just give you a little glimpse of what is happening in this part of the world. We used to watch what was happening in the US and in UK and said it won't be so bad here. Yesterday, I was told that there were 20,000 new COVID positive patients in Malaysia. And also about 195 deaths. This happens every day. In Indonesia, the situation is worse. About 2 weeks ago, it was 50,000 new cases every day with about 1,000 deaths every day. The numbers are coming down. Let's hope it stays down because we are somewhere around the 4th or 5th wave. Now, why is it important? It is not possible for just one country. I've known that, and still there are people who don't believe it. We cannot do this by ourselves. We need to collaborate. So what happened in Indonesia is happening to us today. What happened in Indonesia 3 months ago is happening to us today. So we are learning from their experiences about the deaths they've had, about the 150 to 200 staff in hospitals who were laid off or who were quarantined, and how did the hospital survive? Running out of personal protective equipment, not enough masks or not suitable masks, staff overstretched, having to work double shifts. All this were there. So education is a very important part for us to learn with this collaboration. And we communicate. I have meetings with my staff in Indonesia every week and whenever necessary. Just today I had a meeting and they were in tears. Some of their doctors have passed away. Some of their family members have passed away. So what do? We have town halls. I've conducted town halls like having different religions, the Muslims coming together in one hall, the Christians alongside, the Buddhists, the Hindus, and it was really heart-wrenching to see the tears flowing when they talk about how they have suffered and how they can support each other. Research is something else which I'm very happy that we can do that, and new data coming out every day. We have seen the Delta variant, and there is something else called a Delta plus variant, and now the Lambda variant. Now, all this speeds up the way in which it affects people, and the death rate goes up. So we need to be prepared globally. What I think the message I can bring to HHERF and all of us on this Zoom call today is that we need to reset After the Spanish flu, after World War I, World War II, and even after 9/11, life was not back to normal. We had to reset. And I'm quite sure that once this pandemic is over, whenever it gets over, we will not go back to status quo. We'll have to modify our lifestyle. You cannot have big gatherings in halls, conventions. You cannot go to a theater like you used to before. So life has to change, and we have to be prepared to do that. So talking about the numbers, I think it's frightening for us, talking about 20,000 cases. I have many of my doctor colleagues who have passed away. The families have passed away. And what we are doing, if you look around the streets, there are so many people who have lost their jobs, so many who don't have enough food. So even the church, which I am part of, and many churches and organizations have got together and have food banks where every day they distribute foods. People have lost jobs. Domestic violence has gone up because offices are closed. People are living together, which they never used to do. They were not there most of the time. Mental health illness has gone up. We have had to start online counseling for many because of the way it is going. So, ladies and gentlemen, I just want to say that I was drawn to join HHERF because, as it says here, we are building a world integrated, sustainable health ecosystem, which will enable us to come together, share information. Our government didn't know what to do. We had to look out. They are still learning from what happens in other countries and coming here. So I am very happy that I'm part of this. For me, it is 1:30 a.m. now, but I really like that I'm able to join this session and be able to work together with HHERF and to say how it has benefited me. And I hope I'll be able to work with many of you. My experiences in Malaysia, I've been with this particular group as a group medical advisor for the last 36 years, and it has really enriched me. And I have a little bit of a history in the past, being an armed forces medical doctor as well. And as you know, Malaysia went through problems with communist terrorists, and I have been operational in jungles in some of the big forests in Malaysia as well. So I can go on talking, but I've been told not to say too much and there's not enough time. So I will leave it for the Q&A for you to ask me anything. I'll stop here. And let me introduce Mr. Ashraf. Mr. Ashraf was one of the pioneers who started off this organization. And Ashraf is someone who comes with a lot of experience, including the organization of which I'm the chairman of JCI. And he has been the Middle East representative for JCI for many, many years. And Ashraf, I think I won't take much time, but I think you can tell us more. I think the CV you have is so long, I don't want to read from it. Ashraf, all yours. You are muted, Ashraf.
Thank you very much, Dr. Jacob. I really thank you. I'm thrilled with every word I have heard so far from all of you, and I'm honored to be part of this panel to speak to the Leaders Club, which give us this opportunity. Today is very special to address this group and to express why we joined and formed this foundation. I was lucky to be one of the founders, early founders of this foundation. After 40 years of experience working in healthcare, I came to this conclusion and to be one of the people who started this, and strongly believe that it is going to make a big difference in the future of health. When we started this foundation, actually, it came in the middle of the crisis. And Ossama and I and the group that we started talking about it, we were really facing huge disaster, which is COVID-19. COVID-19 actually is not the first virus, not going to be the last virus. But the problem with that virus that it came suddenly, it came very aggressive. It attacks the human being around the globe in a way that we never expected, we never learned about. And we were not ready for it. And I will underline this word, nobody was ready to receive such kind of a disease and such kind of widespread global disaster. And in fact, this surprise made us really, it was an eye-opener for so many things. Eye-opener that we are not ready. Eye-opener that we are not informed. Eye-opener for the people who didn't know what to do. What is the size of the problem? Where to go? What is the magnitude? Even at the level of professionals, a level of healthcare workers, level of health administrators, level of healthcare systems. We didn't realize how big the problem, what are the resources required. And this created huge, actually, crisis later on in the number of beds, in the number of ICU availability, in the number of oxygen supplies. Everything at the beginning of this crisis was really a problem, and the disease spread for all these reasons very quickly. The politicians actually were confused. They never had the right statistics, and they didn't know the size of the problem. Some countries, they have higher level of transparency, others they don't. Some people use it as a political issue. Some people fought for it. Some people were aware actually of the problem from the beginning. They took necessary measures and they succeeded actually to prevent it to some extent better than others. But the whole global scene showed us that lack of and I will here refer to the slide that Ossama just presented to us. There was a lack of a lot of things actually around the globe, and we didn't know the whole theme that we didn't know. The knowledge was scarce, and we were not ready. So we started to think about it, what we really need to know, and we realized that the people have the right to know. We have the right to know the facts. We have the right to know the real research. We have the right to know where this problem comes from. And also we have the right to know, and the people have the right to know what is the best way to face this problem. Unfortunately, this came very late, and maybe a year until facts started to be revealed. And the sources of this disaster, until now, it is not clear to the public. So we don't know what kind of research has been done that might lead to this. There was not enough transparency in the institutes that worked on this research. And at the end, we paid a very high price, very high mortality. The virus keep modifying, and we don't know where we are going with this virus. Eventually, yes, there are vaccines now, but again, we face another problems with the vaccines worldwide. Do we have really equity in the distribution of vaccines? Are all countries have access to those vaccines, or those only who can afford paying for their people to vaccinate them? Developed countries, they succeeded to do very high percentage of vaccination in comparison with developing countries and underdeveloped countries and low resource countries. So people they have a lot of questions about the vaccine. Is this vaccine more effective than the other? So this is another issue. Medications, we started to have a lot of confusion also with medications. Should we take this protocol or that protocol? We were not sure. So this reflects actually a dilemma which was not limited only to one country. I will go back to Dr. Jacob's comment, which is very, very important, which is this disease proves that health issues is a global issue. Human beings are one race, and the challenges we are facing now is going to hit all of us, not only for COVID, but for the future. Who knows what is coming after COVID? Who knows what is being prepared right now in the laboratories and in the research and whatever those modified chemicals used for making medications and drugs, clinical trials. I don't know what's happening. I don't know what is animal trials. Who knows what is coming after COVID? This is another alarm you have to think about. All this wake us up. We need to wake up, we the people. And I'm actually now an official, and I'm chairing a government authority. But as a person, I would say that the people need to be started to be responsible for their health. Education is power. Knowledge is power. If I want the public, if I want the human race, the people to be empowered and take responsibility for their health, they need to be educated. And this education needs to be based on evidence-based information and knowledge. And this information should come from reliable sources, real, true. It's not modified for any political or economic or any other reason of those who have the interest to modify the knowledge and the information. So one of the main missions of HHERF is to get the right knowledge, the right information to the people on time. And I emphasize here the on time, because the new technology now allows us to see what's happening around the globe in all kinds of news, all kinds of politics, all kinds of disasters, but what about health? We really need to make this in the front page, on the headlines. And those who work in media and work in information, they need to get information, real information from reliable sources. So we need to work also with those research institutes. We need to get to them. And this is another aim in the name and the mission of HHERF, is to get and work with reliable sources of research and get the right information on the right time. Now, the tools and the means of how to do this, we really need to start to use technology in our favor. There are huge resources now in social media, in the internet, and all kinds of communications around the globe. We need to get those companies and these industries aligned with us, send the information in the fastest way in communication, reach to millions. I wouldn't exaggerate if even billions of people around the globe. They need that to be empowered. They need to know what to do and when to do it. We need to communicate facts between us, between the countries. We need to remove barriers between the countries. Here we learned the lesson that such kind of new diseases doesn't only hit the poor and leave the rich. It hits everybody. It hits the politician, as well as simple people, as well as educated, non-educated. This is something new that we really need to understand and to work. Once again, I'm making the conclusion that COVID is a beginning. It's not the end. We need to understand it, and we are in the middle of this crisis. Someday it's gonna move from being epidemic to being endemic, but it's not the last one. We need to get ready for the future, and we need to put health as priority number one. Quality of health care and availability of this health care to those who get the diseases and how fast we should intervene in order to prevent death and prevent complications. This is a human right. We need to align all resources from all sectors, and all the politicians need to understand this is priority number one now, in order to keep all the momentum, the economic, the political, the social, everything will depend whether the future is healthy or not. So I see this is a golden moment. I see that everybody, all of us, we need to be aligned. Those who know have the responsibility to get to those who don't know. And the more we expand, the more we align, the more we get together, the more we'll be successful to achieve our goal. I will be more than happy also to participate in the Q&A answer. And thank you again for giving us the opportunity to speak to you and to address you. Thank you.
Thank you, Dr. Ashraf, and allow me to thank Dr. Jacob, Dr. Claudia, for the wonderful introduction about the foundation and the reasons behind coming together to do this. I believe in their talks, they were successful to bring in front of everyone attending tonight how we're trying to make a difference through the collaboration, communication, education, then research. And those four elements are helping us to transcend the individual countries, the local politics, the corporate and medical brand identities. And also this will enable us to work together on a global preparedness ecosystem to ensure that we are in the future ready to face any challenge. Last but not least is the prevention. And we've been all struggling to transform the sick care systems. And I insist on using the term that Mark Adams has been always using, that we don't have a healthcare systems. Our systems are just treating sickness. We want to transform this into a health and care systems. We want to transfer this mentality that we, rather than waiting until the people are sick and then we treat them, by working together and collaborating on sustaining and maintaining health. And this has to start as early as the young generation and even the old generation. This takes us to the main annual meeting and platform of HHERF, which is our main opportunity to bring people together. And the annual meeting of the Human Health Education and Research Foundation is named Human Health Summit. The Human Health Summit is titled this year as COVID-19 before, now and after. We're trying to build a sustainable community for a healthier future. But the interesting thing about this event that will happen on the 29th of October until the 1st of November this year as a virtual event, and I invite all of you to attend. I am more than happy, and I think all the board members will support this, that we extend the free registration attendance to all the Leaders Club members. And the uniqueness about the summit, that it's not just another virtual meeting. It's a summit and beyond, because we've been thinking about how can we transform the way events are taken by people, where we invite a speaker to speak about a topic and participants to listen. And then after the event, we're just all going back home and nothing happened further. The Human Health Summit is supposed to be a start of a race. It's a start line where we will gather together, bring the multi-sectoral experience together to look into the challenges human health is facing. Then we decide on the roadmap and the action. And the moment the summit is finished, it's a beginning of a race. This race is going to be 12 laps. Each lap is 1 month. And we are going to work on these outcomes that the summit agreed on, these recommendations, these declarations, to make a difference until we come back at the end of the race and the beginning of the following summit. But this is how we look at it, and this is how we try to make a difference. Ladies and gentlemen, tonight we're talking about an effort of 75 people. Claudia mentioned 74. Just before the meeting, I had one more member from Cuba, which means that we have 75 people from 35 countries. And this is what we can achieve when we work together. I invite all of you, whoever would like to add something to the foundation, please do not hesitate, reach out to us, and let's make a difference together. And last but not least, I love to look at this photo. Consider HHERF that started in July 2020 as just a drop of water that is falling and creating a very small ripple. We have in our hands the decision to make this ripple fade away and die, or we can turn this into a wave and turn the wave into a rope and make a huge difference for humanity and human health. Thank you very much. Thank you very much, Steve. Thank you very much, Bob. And thanks to everyone who's attending from our eminent members in the Leaders Club. Thank you.